In this video, we will talk about 6 amazing health benefits of fasting proved by modern science. Despite its recent resurgence in popularity, fasting is a practice that dates back centuries and plays a central role in many cultures and religions. Christians believe fasting is a way to draw closer to God. Some Buddhists believe that they should not eat after a noon meal and the intervening time should be spent in meditation. Hindus believe willful detachment from food purifies mind and body, bestowing positive spiritual benefits, and in Islam, fasting is practiced to reinforce faith and piety. It should be noted that in this video, we focus on the intermittent fasting, which alternates between fasting and eating. This method, generally practiced by Muslims, involves not eating and drinking during certain hours each day. Defined as a voluntary abstinence from eating and drinking for a set period, scientific studies have discovered that intermittent fasting is beneficial for many aspects of human health, and here are 6 of them. Number 1. Fasting protects the brain. In fact, what's good for your body is often good for your brain as well. In a study entitled Brain-Derived Neurotrophic Factor and Neuropsychiatric Disorders, published in 2012 in the Pharmacological Review journal, the researchers proved that intermittent fasting improves various metabolic features known to be important for brain health. These features include oxidative stress, inflammation, blood sugar levels, and insulin resistance. Fasting also increases levels of a brain hormone called brain-derived neurotrophic factor. This is a crucial hormone in the human brain because its deficiency may be involved in depression and other brain conditions. Additionally, research suggests that fasting significantly preconditions the brain against post-stroke damage and improves the long-term functional outcome. Number 2. Fasting can delay aging. One of the most exciting applications of intermittent fasting may be its potential to extend lifespan. Research in rodents has shown that intermittent fasting extends lifespan in a similar way to continuous calorie restriction. In a study entitled Every Other Day Feeding Extends Lifespan but Fails to Delay Many Symptoms of Aging in Mice, published in the Journal of Nature Communication in 2017, the researchers found that mice that fasted every other day had about a 13% increase in lifespan. Daily fasting has also been shown to improve the overall health of male mice. In a 2019 study, it was found that intermittent fasting helped delay the onset of conditions such as fatty liver disease and hepatocellular carcinoma. According to a 2021 study, periodic fasting was observed to enhance the diversity of beneficial bacteria within the human gut microbiome, particularly increasing the abundance of Chrysanthemella species, which are considered to be linked to longevity. This suggests that fasting may positively impact lifespan by influencing gut bacteria composition. Number 3. Fasting reduces the risk of type 2 diabetes. A study conducted in 2023 and published in the Journal of Natural Medicine found that intermittent fasting may improve blood sugar control, which may be helpful for those at risk of developing diabetes. In fact, type 2 diabetes occurs when the body's cells don't respond effectively to insulin, and it loses its ability to produce the hormone, which is responsible for controlling glucose in blood. Researchers from the University of Adelaide and South Australian Health and Medical Research Institute found that people who followed the intermittent fasting diet were more sensitive to insulin and also experienced a greater reduction in blood lipids than those on the low-calorie diet. They concluded that nearly 60% of type 2 diabetes cases could be delayed or prevented with changes to diet and lifestyle. Number 4. The effect of fasting on cancer. In fact, cancer involves uncontrolled growth of cells. Fasting has been shown to have several beneficial effects on metabolism that may lead to reduced risk of cancer. A study entitled Effect of Fasting on Cancer, a narrative review of scientific evidence published in the Cancer Science Journal in 2022, found that intermittent fasting could play a key role in cancer treatment by fostering conditions that limit cancer cells' adaptability, survival, and growth. Benefit number 5. Fasting decreases the risk of heart disease. In fact, heart disease is currently the world's top cause of death. Heart disease is responsible for 13% of the world's total deaths. Since 2000, the largest increase in deaths has been for this disease, rising by 2.7 million to 9.1 million deaths in 2021. So, Scientific studies show that intermittent fasting can improve many risk factors for heart disease, including blood pressure, cholesterol levels, triglyceride levels, and inflammatory markers. In his study entitled Effect of Ramadan Fasting on Body Weight conducted in 2014, Salahuddin and his colleagues revealed that Ramadan fasting could be used as a non-pharmacological therapy to support antihypertension therapy in reducing blood pressure in a person with hypertension. This was proven by the result of the study, which showed a total of 15 hypertensive patients experienced a decrease in their systolic and diastolic blood pressure after fasting. Number 6. Fasting prevents Alzheimer's disease. Alzheimer's disease is the world's most common neurodegenerative disease, and there is currently no cure for it, so preventing it from developing in the first place is critical. In their studies entitled Effects of Intermittent Fasting on Cognitive Health and Alzheimer's Disease, published in 2023 in the Nutrition Review, the authors concluded that intermittent fasting may help delay the onset of Alzheimer's or reduce its severity. To conclude, let us summarize some of the changes that may happen in your body as a result of intermittent fasting. Number 1. Insulin level. While fasting, your blood level of insulin drops significantly, which promotes fat burning. Second, human growth hormone level. Your blood level of HGH increases dramatically. Higher levels of this hormone promote fat burning and muscle gain and have numerous other benefits. Number 3. Cellular repair. Intermittent fasting enables your body to start important cellular repair processes, such as removing waste material from cells. Number 4. Gene expression. While fasting, beneficial changes occur in several genes and molecules related to longevity and protection against disease. Many of the benefits of intermittent fasting are related to these changes in hormones, cellular function, and gene expression. That is why in many clinics, patients are now monitored by physicians while undergoing water-only or very low-calorie fasting periods lasting from 1 week or longer for weight management and for disease prevention and treatment. And in Islam, fasting is one of the 5 pillars. The Quran prescribes fasting during Ramadan as a spiritual discipline to promote righteousness and God consciousness. Allah says in the Holy Quran, "O believers, fasting is prescribed for you, as it was for those before you, so perhaps you will become mindful of Allah." Thank you for your time. Assalamu alaikum.